Now, it would seem there is no end in sight for the striking clinical officers and medical laboratory officers who've been out of work for more than 70 days. A series of meetings and engagements with the Ministry of Health and the Council of Governors have not borne fruit. While laboratory officers are pushing for the signing of a recognition agreement, clinical officers, on the other hand, are demanding absorption of universal health coverage officers into permanent and pensionable terms. And as Emily Chebet reports, a number of medical unions appeared before the National Assembly's Public Petitions Committee to air their grievances.
The Kenya Union of Clinical Officers has been engaging in a series of meetings with the Ministry of Health and Council of Governors. But 73 days after the clinical officers downed their tools, the stalemate is yet to be unlocked. The clinical officers have accused the government of turning a deaf ear to the plight of healthcare workers, which include implementation of their risk allowance, posting of interns, and hiring of more officers to reduce the burden in various government health facilities.
In Nairobi, we have more than 22 facilities that do not have even a single clinical officer. In any case, they are not operational. It is actually something that replicate, or rather is a replica to most of the counties. And therefore, this should be their agenda.
Our interns have not been sent to their facilities that they're supposed to be interning in. They have stayed for over 1 year. So that is somebody who has lost 1 year of their life, because as clinical officer, you cannot practice without a license.
The National Assembly's Public Petitions Committee met different medical unions in a bid to end perennial strikes in the health sector. Among the issues presented before the Nimrod Mbai-led committee are delays in posting of medical interns, absorption of UHC contract staff into permanent and pensionable, conclusion of CBAs and recognition agreements in the health sector in the country.
We have different categories of UHC colleagues. We have the CHAP, that's the COVID-19 Health Emergency Response Program colleagues, and then we had also the UHC interns who were also given the personal numbers, and we have not had the ministry proclaim itself on this matter.
We have a problem where our members who are working in the counties are on strike. We've not had any opportunity to have a sitting with the chair of governors or any of their representatives, and we have only signed so far 6 recognition agreement, and 41 have not been signed.
We give you 7 days. Go sit down, do your homework right, do a status report in a written form, which now you can present to the clerk of the National Assembly. The committee will sit over them.
Healthcare workers from different unions have been given 7 days to write their status report on the engagement between the county governments and the national government. It is a wait and see to see whether the Public Petitions Committee at the National Assembly will end the stalemate at the Ministry of Health. Emily Chebet, Citizen TV at the National Assembly.